we've reached a point of public near consensus that avoiding COVID is more trouble than it's worth, and people should just go back to how they were living in 2019. And I think that is, frankly, a mistake and not supported by the available evidence. I continue to wear a mask because I continue to think that it's really worth quite a lot of effort to avoid getting COVID or get COVID as few times as possible. It's easy to see how we got to where we are. Trying to avoid COVID is inconvenient and disruptive to the economy. In many ways, imposes costs on capital, on wealthy and powerful people in particular. If, you have to let your employees take enough time off of work when they get sick to avoid spreading COVID and, improve ventilation in workplaces and provide for testing and masks and things like that so that people can work safely, that all imposes a lot of cost on capital. So there's a lot of incentive for society to come to an understanding that actually it's fine to just get COVID all the time because the alternative is expensive. And that is where we've ended up. And on an individual level, it's really difficult to, sort of buck the consensus that you perceive all around you. But I think that if you put that out of your mind and try to just engage directly with the data, the studies people are doing, the science that's been put out about specifically the long-term effects of COVID, it's not fully clear just how bad it is. And it can't be because it's bad it could be bad on a scale of decades. And we just couldn't possibly know yet. But on balance, it looks like it's somewhere between bad and really horrifyingly bad to get COVID over and over again.
Right.
So yeah, as much as possible, I'm really trying to avoid it. And, it's been 4 years since the pandemic started, and I don't want to completely put my life on hold. And this is an occasion to acknowledge my privilege in this, that my life is such that I can completely put it on hold if I want to. Most people don't have that choice for various reasons. And I can be extremely cautious in ways that most people don't have the option to be. A big one being like anybody I know who has kids. I mean,
it's impossible.
It's just impossible. But also, I have a job where I can be choosy about when and where I work, and I can wear the protective gear I want, and I can't be fired. Not everybody has that privilege either. But yeah, so I am choosing to take some risk at this point, but really trying to manage it, minimize it.
I think it was kind of funny also. I've had this thought before, but it kind of crystallized when you were saying that the biggest barrier to it is just the weirdness of being like the only person wearing one in a lot of spaces, or one of the only people, but that everything else about it makes sense to you, and there's just the kind of well, but no one else is doing it, maybe I'm the one who's wrong kind of thing. But that it used to be the thing to call people who are wearing masks sheep, and now what you're describing is of course profoundly anti-sheep behavior, where the sheepiness is the thing that you're fighting against by still wearing it.
It's funny, I still get called a sheep. The feeling of being the only one still doing it is strange and uncomfortable, for sure. I understand why a lot of people who otherwise might wear a mask, might be more comfortable wearing a mask, don't, because looking weird is too uncomfortable. There's this really weird phenomenon that you can see in polling all the time. Fewer polls like this are being run these days, but in, 2021, 2022, as mask mandates were being rolled back, over and over, you'd see this exact same thing in polls. They would ask, do you think there should be a mask mandate in general in public places, or on the subway, or in supermarkets, or whatever? And you'd get 60% yes. And then they'd ask, are you currently wearing a mask in the place in question? And you'd get 20% yes. Quite a few people want everyone to be wearing a mask. Surprisingly few people are willing to wear a mask when no one else is.
Interesting.
I can tell you, as someone who recently had a family member in the hospital, even when there is a mask mandate in place, it is not a trivial thing to get the staff to actually wear the mask.
I'm sure. Yeah. It's very messed up. The spread of COVID in hospitals is just such a grim situation, and the extent to which nobody with any power to do anything about it seems to care. The stats specifically on like how much your chance of dying before you leave the hospital goes up if you contract COVID while you're there are really bad. I can't remember the exact numbers, but like it really dramatically increases your chance of not making it out alive if you're already in the hospital for, say, a heart attack or cancer or whatever. You're in the hospital for something else and you catch COVID while you're there, which is happening constantly these days. It's really bad for your chances of making it out alive.
One of the many things that COVID sort of disillusioned me about was some things that I thought were sort of skills that people were acquiring from poker, understanding statistics, and the number of successful poker, these are people that I know, not like random trolls, like successful poker players on Twitter saying things like, "I was only a 1 in 1,000 chance of dying." Like that's a really high number. What do you think your odds of dying are usually?
Yeah. Trying to imagine like other things where you die 1 in 1,000 times and how you would feel about doing them. It's not like getting in a car. It's like getting in a car crash.